Hey, Dr. Auer here. Today's video, I want to discuss functional laboratory testing, overall lab tests, and why you might have had the experience of going to the doctor, running a bunch of tests and not feeling well, only to be told that everything is normal and that everything is fine, but you don't feel fine. So, the first thing that we need to discuss with lab testing, not all lab testing is the same. Please note that it takes about 17 years from a new technology when it's developed, so a new lab test, to find itself to gold standard medical care. So really important to note that the lab testing that you run with your doctor today in traditional medicine is quite behind what's coming out with the newest technologies and the newest research. So when you go see a functional medicine doctor, and let's take a stool test for example, you might have already done a stool test and everything was fine because Western medicine looks for pathology. They don't look for optimal function, and so are the lab tests kind of geared. Now in functional medicine we say, well, okay, hey, let's take the most cutting edge technology, might be a DNA stool test, a PCR technology versus a cultured stool test, which is going to be a lot more sensitive and also going to be geared at showing overall imbalances that are not a disease yet or not a pathology, but it might start to explain why you feel the way you do. So please note that not all lab testing is the same. Traditional medicine is amazing at keeping you alive, but their focus is pathology and disease. Functional medicine's focus is optimal performance, and we utilize cutting-edge laboratory testing to find which systems are not working at its optimal. The second is ranges. So let me give you an example. We see a lot of patients that come to us with blood work. So when I run blood work, your vitamin D, your CBC with differential, metabolic, inflammatory markers, your lipids, liver enzymes, all those things, those are lab tests that I don't really use different technology. So I use the same tests, for example, that your doctor does, but we look at them slightly different. We kind of put on a different lens because understand again that Western medicine focuses on disease. Again, they are geared to keeping you alive and they're amazing at that. So it's a very black and white world. You're either sick or you're not. You have a pathology or you don't. You have a diagnosis and you can receive medication or you don't. But there's a lot of gray zone within that black and white world where you might start to have symptoms that are not being identified when you look at it through this black and white lens. Functional medicine, so please understand that, right? So within the disease model over here, this is where you have pathology. Well, but what happens if you're right here? That's your marker. Well, you're normal, but you don't feel normal. But see, functional medicine says, well, okay, that's cool. Hey, but let's highlight the optimal area that we found with thousands and thousands and thousands and thousands of patients. What do we find is the most optimal for this marker? So if you fall outside of here, we might just say, you know, you're a little bit high right here. Does this mean anything? I don't know. How do you feel? Let's run also more markers and more markers so we can go deeper and broader so we can understand how well all systems are working individually and as a whole. So when you look at lab testing next to technology, you need to look at ranges and understand that when you look at a LabCorp or a Quest range and your doctor says, hey, that's normal, that's not necessarily the case. Finally, we really need to discuss the interconnectivity of all your body systems. Traditional medicine likes to silo out a system. You have joint pain, you go to the rheumatologist. You have stomach or gastrointestinal symptoms, you go to the gastroenterologist. We have hormonal imbalances like thyroid, we go to the endocrinologist. We go to the dermatologist for psoriasis and eczema. And we start to silo out the body. I have joint pain, let's look at your joints, let's look at RA, right? But the problem with that is that you may have a gut issue, an overgrowth of a certain bacteria. Maybe these bacteria that are, there's a bacteria called Prevotella that is commonly seen with rheumatoid arthritis patients. And this bacteria can upregulate your immune system to start attacking the joints. Well, If you go to the rheumatologist, they will run an RA factor and maybe some inflammatory markers and maybe give you medication. You may fall inside of that black and white world and get a diagnosis, but you may not and just be in pain and not be diagnosed. But it's important to note that if we look at the body from an interconnective component, then we also need to understand that your gut may cause your joint pain. Your gut may cause your anxiety and depression. Your gut may cause your skin issues. Make sense? So we have to understand that all systems can affect each other, and we have to take a look at each system individually, make sure that it operates at its optimal range, and then understand that they all work interconnectively, okay? So when you look at lab testing, not all lab testing is the same from a technology perspective. If we are using the same lab testing, please consider that we may be looking at different ranges. And finally, when we do lab testing, how are we looking at the body and how well it's connected? Are we looking deep enough? Are we looking at other seemingly unrelated systems that may be affecting some of your symptoms or your presentations that don't necessarily make a lot of sense right off the bat, but there may be a connection that you haven't figured out? So I hope this was helpful in regards to laboratory testing and how we utilize laboratory testing in functional medicine. Yeah, we'll talk soon.